All right, welcome everyone. Today we are diving into a modern functional approach to post-concussion care, specifically addressing dysautonomia and POTS. Two of things are very common nowadays and that we see in our clinic. Okay, we'll explore how controlled exercise and multimodal therapy are shifting the recovery paradigm today. My name is Dr. Riley Edling. I am a chiropractor. I have completed my clinical neuroscience hours at the Carrick Institute, and I'm going to be providing a little bit of insight on these conditions today. So, a shift in concussion recovery. Okay, for years, the standard advice was strict rest. Okay, no screens, no school, very little activity, if not no activity at all. Okay. But now we know this approach can actually delay healing and worsen outcomes, especially for the autonomic nervous system. Okay. Today, we promote early strategic activation that gently engages the brain and body during recovery. Understanding dysautonomia after concussions. Okay, concussions can affect the autonomic nervous system, leading to dysautonomia. Right, dysautonomia is just an umbrella term for dysfunctional autonomic nervous system. Okay, when areas like the brainstem or the hypothalamus are disrupted, patients may struggle to regulate heart rate, blood pressure, and blood flow. Okay, this is often misdiagnosed or misunderstood. Recognizing signs like POTS or vestibular autonomic coupling issues is critical. So, what is POTS? Probably have heard this before: postural orthostatic tachycardia syndrome, or POTS is again the most common term. It's the most common form of dysautonomia. When these patients stand, their heart rate jumps up dramatically, and they're going to feel symptomatic in the sense that they may feel dizzy, they may feel tired, they might feel foggy, like they just have this brain fog that's going on, and also lightheaded. Okay. The overlap with post concussion symptoms can be confusing unless you are specifically screening for it. Okay. So, exercise is medicine. There's been a ton of research that's been going on in the last decade regarding POTS and dysautonomia. Okay, and there's a lot of great stuff. So, groundbreaking research, especially by Letty and Willer, shows that aerobic exercise at a safe threshold does not hurt. It actually helps. All right, it restores blood flow regulation, enhances mitochondrial function and performance, and reboots your autonomic nervous system. This flips the old thinking on its head. Exercise is not harmful, it's therapeutic. All right. We need to continue to be active. So, to prepare, activate, recover model, cognitive FX. All right. Cognitive FX introduces a model that breaks down how to use exercise in a therapeutic sequence. We start by preparing the brain, getting blood flow up. All right. Number one. Then we activate engaging attention, vision, and your vestibular systems. All right. Everything is very finely intertwined. And finally, recovery. Cool down is structured and intentional so we don't overshoot. This helps embed gains neurologically. Okay. So, graded exercise progression and the Buffalo and Boston protocols. So, very common protocol. It's been around for a while. We use the Buffalo concussion treadmill test to determine each patient's symptom limited heart rate. From there, we prescribe aerobic activity just under that threshold. All right, super important to be under it. Okay. As tolerance improves, we move through Boston Children's stages from light walking all the way to full return to contact play. It's systematic and safe, and it's heavily researched. Great tools that we use. So the multimodal integration here at the FNC. All right. Um, Exercise is just one part of a bigger strategy. We layer in vestibular rehab, cervical proprioception, laser therapy, PEMF, and vagus nerve activation. These combined therapies help retrain the nervous system on multiple levels: your sensory, motor, metabolic, and autonomic. All right. There's also the old thinking that you see one area dysfunction, let's just say with your visual system or just vestibular, and you only hit that for rehab. It's about having to hit multiple areas so your brain and body can integrate that information and process things efficiently and accordingly. So, quick little case study. 17-year-old athletes, a young soccer player came to us 6 months post concussion with classic dysautonomia symptoms. His exercise threshold was extremely low for his level of activity. Over a 8-week course with a full multimodal plan, he progressed from a 110 beats per minute to 170 beats per minute tolerance, and his return to play was with zero symptoms. And this is the outcome we strive for with everyone. Not everyone's going to respond the same. Everyone is going to be different. That is just how everyone's brain is. All right. No one is hardwired the same. All right. But again, just an example of what a concussion can do. Bring your exercise tolerance down to the absolute minimum. Doesn't mean it's going to be stuck like that. You do a multimodal approach, and you can surely have a great recovery. So, kind of some key takeaways. Concussion-related dysautonomia and POTS are not rare, and they're not lifelong to any sense. Okay, when we use exercise smartly and support recovery with complementary therapies, we can reset the autonomic function and promote brain healing. It's time we move away from the inactivity and lean into strategic, evidence-based activation. Super important. And I know we don't have a live audience here, but more so some questions that we might want to ask other practitioners. All right. How do we assess for dysautonomia early post concussion? How can chiropractors and clinicians implement sub-symptom exercise testing? And when do we introduce multimodal therapies like laser, PEMF, or vestibular rehab? All right, it's things that we need to assess early on instead of just catching things late and jumping into maybe more advanced therapies. All right, there is a need for a proper and specific approach, and it really just starts with assessing for dysautonomia early after a head injury. All right. Thank you guys so much for tuning into this presentation. And we got many more to come. And I hope you're enjoying some of our content here.